Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IBCLC and Director of Communications here at Gold Learning. Well, thank you so much for joining us here today. I'm very excited. We have a celebration day coming up here at Gold Learning, and we're going to be celebrating IBCLC Day. And we have Megan Dunn, who's going to be celebrating with us. Welcome, Megan. It's great to have you here today.
It's really great to see you again, Fiona.
So we're going to be talking about what's coming up at your presentation for IBCLC Day. And of course, we've been promoting it and thinking about why this topic is so important. But first of all, I want to make sure that everybody knows where to go and grab this presentation because it is going to be free and open access. You will be able to get a CEU with it. So head over to our website at goldlearning.com and you can search for Megan's name on there. It should come up right on your screen, I hope. But we're going to be talking about Spit Happens Managing Infant Reflux. So welcome back to Gold. Is so excited that you're going to be talking about this topic with us. And so I wanted to dive right in because I realized that, you're very passionate about this. So I want to know, like with infant reflux, it can be so stressful for families, Megan. And I know this is probably something that you've seen before and probably some of our listeners. And it can also be very frustrating for providers. I think there's maybe some confusion and things around it. But what first drew you to really focus on, reflux management in your practice? And I guess what keeps you invested, in helping us and now putting on this amazing presentation?
Yeah, this is a super common concern that parents have. A lot of times we're seeing an increase of regurgitation that matches up with some developmental timeline things like fussiness and crying, and they kind of go hand in hand. And
Hmm.
so parents often perceive that their baby's in pain when they're having regurgitation, and that's often not the case at all. And
Right.
we also know that medical providers sometimes aren't quite sure how to manage reflux outside of medication management, which is typically not indicated for infants. So I really wanted to find a way that we could incorporate IBCLCs into primary care practice because we all know that when we work with families, with their medical providers, we have way better outcomes for both parents and babies.
Well, that sounds amazing. And I know that you've been working very hard in your practice, to make that happen. You've been doing some collaboration work, which is just fantastic. I can see how this presentation is going to change, how people do practice. And I think more communication is definitely needed. So I'm excited for you to sort of intertwine that and share some of what you've been working on as well. Um, reflux accounts for a really, fairly significant percentage of early infant out, concerns. And so, in your experience, where do clinicians most often sort of misinterpret normal physiological reflux as something more serious? And where do you see the risk, of missing those true red flags that come up for families?
I think a lot of parents are really concerned about the type of regurgitation that comes with fussiness or other types of symptoms. And it can go one of two ways when we're starting to see babies that are really upset and parents that are very concerned. Sometimes we start medications sooner than we should. And I
Hmm.
think that a lot of times our primary care providers are in a little bit of a bind. Parents want active management. They want something that they can really do right away, other than just being told that this is pretty normal for their babies. And then other times we step into making dietary changes for the parent that often are not indicated.
Right.
And sometimes our pediatric providers, who are not the parent's provider, are making these recommendations to a parent, and they may not understand that there's a lot of stress and nutritional risks, as well as time and risks to early weaning when we
Mm.
tell a parent that they need to change their diet. So we get kind of stuck and we don't know exactly what we need to be doing for these families. And there's a lot outside of medical management that comes down to things that IBCLCs can do. We can help parents with the direct chest feeding, nursing aspects, as well as bottle feeding and interpreting babies' behavior. A lot of what we're doing is helping parents understand their baby's nonverbal communication, clarifying where general practices need to be adjusted for the individual baby. There's a lot that we can do outside of really big interventions like dietary changes and medication.
Oh, I just love that idea of being able to sort of sleuth out all the different aspects of, what's normal, what isn't, and how reflectively, it's impacting. But I think there's almost, do you feel that, IBCLCs can also become sort of almost the interpreter for other professionals in the field too, so that that helps them make an accurate diagnosis?
Absolutely. I'm really lucky with where I work that I get to work closely with our pediatric providers, and we have a great and trusting relationship. And I hope that all IBCLCs are able to form those relationships when we're working together in care coordination with our midwives, with our doctors, with other feeding specialists like SLPs and OTs, and we're able to collaborate. I think that families are better able to get these really great outcomes and they feel really empowered. We know
Mm,
that one of the ways that we can help parents meet their feeding goals is to feel confident that they're doing a great job. And some of it just comes down to like really basic information. And other times it's us in that role of the IBCLC watching that entire feeding from the beginning to the end. And we also have this really unique role because we are the provider for the parent and for the baby. There aren't a lot of other providers that typically are managing and treating both. So we
right.
get to have a special role where we get to see them in the context of feeding rather than a pediatrician getting the information about the baby, but not really knowing how to manage the parent.
Yeah, I love that. The aspect of collaboration and working together. How do you feel that parents are doing today with reflux? Are they still at a loss of what's happening? Is there too much conflicting information? Are they feeling empowered yet? Megan, what happens when they show up in your office?
I think a lot of parents are really confused. The internet is great in so many ways, but it also holds on to a lot of outdated information. And I
Mm,
talk to a lot of parents, and I see them online as well, talking about multiple dietary changes or trying lots of different supplements and
right.
making a lot of adjustments that may not be warranted. So they're spending a
Mm,
lot of time, stress, and money trying to solve these issues. And I think that if they could work with an IBCLC who has some additional training and knowledge, like we're going to get in
mm.
this presentation, we can all feel a lot more empowered to help these families figure out what they need for their specific situation.
Yeah, that's really good. That's something that I'm really keen. I feel like I need more tools in my tool belt. It's like this topic doesn't come around often enough sometimes, you don't hear about it for a while. And I'm so glad that, that you reached out and are so passionate about it. Can you tell me what do you know about the actual guidelines in North America and Europe when it comes to reflux? What is happening in that area right now, and how might that reflectively support IBCLCs or the relationships they have in the medical field as well?
Yeah, this presentation really expands on those medical guidelines. They were updated in 2018, which is a long time ago, but also semi-recent when we think about how slowly things can move in healthcare.
Hmm.
And these recommendations were a joint task force between North American and European pediatric specialists to help clinicians determine the differences between normal physiological reflux and GERD, and when we need to be making some of these recommendations for medication management. We saw a huge uptick in prescriptions for PPIs and H2RAs, which are
Mm,
medications that are acid reducers for infants
right.
in the decade prior, and they have a lot of side effects, and they can have some really bad things occur for babies, so they're not always warranted. So
Hmm.
this medical algorithm is kind of vague. There's some pieces of it that need a lot of expansion. It doesn't really talk about how you can use an IBCLC or even how you could use a physical therapist. Those are things we're going to talk about in the presentation and about all the different types of care providers and how we as an IBCLC can help recognize when we need to make referrals to those other types of providers. So the guideline, it's a really fantastic meta-analysis. I'd encourage people to read it if you like to read scientific journals like I do because it has a lot of really helpful information, but it's not designed for an IBCLC to interpret. It's really about how to recognize things like FPIEs or IgE allergies and when we should be making changes from a medical management standpoint. So we're going to dig into each of the steps of that algorithm, and we're going to talk about how we can expand it and how we can apply it to the different kinds of populations that we see. As an IBCLC, I see families that are exclusively nursing their babies. I see
Hmm.
families that are combination feeding, either with their own pumped milk or alternatives in bottles. And I see families that are only using formula for their babies. And I need to know how to help all of them feel more empowered and have happier babies. And so having a differential management, I think, is really, really important because I don't want to make big changes that could cause a parent to wean too early or
Right.
use supplements that may not be safe for their baby.
Well, that's great. I mean, I can't think of anything better than to get tools into my tool belt right away, as we say. So I know that you're pretty much a master at interpretation when it comes to the research, and I appreciate that. But I know that, that'll be something that folks will take away from this presentation. And I know medication discussions, I think it's ongoing, for families. And then I think parental anxiety, we've seen an increase in that most recently. Feeding adjustments. I mean, reflux can quickly become overwhelming, when you add up all the pieces. So tell me, what do you most hope that clinicians will feel more confident about after attending your session with us?
I hope that people are going to leave with really specific recommendations that expand that algorithm so that they know what is overfeeding. How
Mm,
do we specifically define that? And then some of
right.
the more subtle things that we see with babies too, that affect their anatomy and development that can increase reflux and regurgitation. I also hope that people leave understanding that there's a really big difference between reflux, regurgitation, and GERD. It's three separate things, even though we casually use them all in the same conversation. If we can understand that, then we have a way that we can connect with parents and help them to feel better educated and help them to feel like they have the tools in their toolbox to be able to help their babies feel better too.
Yeah, those definitions are definitely going to be really valuable and important as we continue to educate our families and work with them in this area. Megan, thank you so much for spending the time with me today. And as we took like just a little dive into this presentation, I'm so excited for you to be able to expand it out with us on our IBCLC day. So as I mentioned, Megan's going to be here. We're actually going to be celebrating IBCLC Day, and this is how we do it. We provide some incredible education with our amazing speakers, and of course, everyone is invited. And we know, as we were thinking about this topic, and I was talking to Megan earlier, that this topic really touches all of us that work in the perinatal field. So everyone is welcome to join us for this presentation, and of course, you'll get your CU with us as well. It's free and open access. Make sure that you go over to the website at goldlearning.com to register for it, and then you can watch it live with us. We hope, Megan, you're hoping we get lots of live friends that come and join us. You and I'll have a chance to have a Q&A as well, so we'll be answering some questions on site. And then, of course, you'll be able to listen to the recording. Megan, thank you again for joining us here today. It's been lovely chatting with you.
Thanks, Fiona. Always like talking with you too.
Thanks, everyone. We'll look forward to seeing you all online very soon. Bye bye for now, everyone.